We truly are the Rainbow Nation. South Africa is blessed to have constitutional protection for all its people. Despite this, the reality remains that many lesbian, gay, bisexual, and transgender people, LGBT for short, continue to be stigmatized and discriminated against, and at times even face violence.
Experience shows across the continent that LGBTI people have it bad. They're on the receiving end of society. We have a variety of issues such as stigma, discrimination, prejudice, violence, service delivery questions.
In fact, 39 out of 53 African countries still criminalize consensual same-sex practices.
We're very fortunate in South Africa having constitutional protection, but the reality is that on a social level there are still vast inequalities.
Celebrating 15 years of servicing the health and well-being needs of the often neglected LGBT community in the midst of the devastating HIV epidemic, OUT services remain as vital as ever.
The challenges that LGBTI people experience in terms of accessing mainstream service providers are basically around stigma and discrimination. Service providers, including the healthcare professional, they put their own belief before what they are required to do.
The remarkable OUT journey began in 1994 when a group of concerned individuals formed the Gay and Lesbian Organization of Pretoria.
At first it was really a social group. People met every Sunday for social events. And then about a year later, in 1995, that group of people felt that they have to do something in terms of providing services for LGBT people, realizing that LGBT people possibly don't find it that easy to access mainstream services.
During the last decade and a half, the organization was renamed OUT and became increasingly professional in its services and outlook. Some of OUT's achievements include its groundbreaking research in 2003 to assess the needs of LGBT people. This provided the foundation for OUT's services and strategy.
In the Gauteng study, 6% of the respondents have actually been refused healthcare services, where 12% delay seeking healthcare because they fear stigmatization and discrimination.
OUT also took part in the historic campaign to legalize same-sex marriage through its key submissions to Parliament. South Africa remains the only country in Africa and only one of 10 countries in the world to offer its citizens equal marriage rights.
It's a translation of rights into justice, I think, broadly, for all of us.
The fact that same-sex marriage was legalized in South Africa affirms the equality between same-sex practicing persons and heterosexual persons.
It's really an amazing part that people now can go to church or go to the Department of Home Affairs to get married.
A permanent, safe and welcoming environment was always a necessity for OUT to provide its services effectively. This became a reality in 2007 with the opening of OUT's Prism Lifestyle Centre, now in Hatfield, Pretoria.
Prism Lifestyle Centre does offer that space free from stigma and discrimination where LGBTI people can freely express themselves and access those services.
2009 saw OUT beginning to venture from its Pretoria base with the establishment of its first satellite branch in Mafeking.
It's a first in South Africa and I think also in Africa, where there's a permanent service organization within a more rural setting.
Today, OUT is overseen by a board, is registered with the Department of Social Development and has 14 permanent staff members. Its services include HIV and STI counselling and testing, CD4 and viral load monitoring, Pap Smears for lesbian women, and general physical examinations. There's the provision of post-exposure prophylaxis for risky sexual encounters, wellness adherence, treatment literacy, referral, and follow-up. OUT makes its way directly into the community by offering free HIV testing and safe sex packs at events and nightclubs. OUT is also well aware that people's mental state influences their behavior and choices, which will in turn affect their physical health.
Psychological issues are important because if you live in a society that discriminates against you, for example, the whole time they tell you you're a sinner and you'll go to hell and you can't be like this, at some point you probably start believing that with implications for your self-esteem and those sort of issues.
The critical part is that people need to understand the social relations of gender identity and sexuality. And OUT has got a level of expertise when it comes to addressing these issues.
In addition to face-to-face counselling, OUT offers telephonic counselling as well as various monthly support and activity groups. The groups offer social networking opportunities, skills training, improved self-esteem, and foster a sense of community. OUT's online resources, men2men.co.za and woman2woman.co.za, provide easy access to information on sexuality and sexual health. The organization further offers training on the needs of LGBT individuals to others in the health and well-being arena to help them be better prepared to serve this community.
It's very important that OUT get involved in training other service providers because now we increase the capacity of the country as well in terms of response to the needs of LGBTI people.
OUT would want to train people working in these organizations to ensure that when clients do come in these places, they have the same kind of services that they would access in LGBTI self-identified centers.
The future holds great promise for OUT. A central Johannesburg branch is planned, as is expansion into Mpumalanga and ultimately nationally. OUT will also continue to use its expertise to train other less resourced groups in the country and the continent, steadily spreading its rainbow across Africa.
I think our community is marked by a lot of apathy around our issues. So I would like to see a future where people become more involved in their community and furthering their interests.
It can develop other organizations, not necessarily LGBTI organization. It can exchange with any other organization, including government of South Africa and other governments outside South Africa.
I think we are, quite talented, but also we need to remain vigilant. We have stood up to challenges that have rocked us. And I think more importantly, we have a role to play in the broader society.